I am Beth Roden, our head of communications for Bayer in the U.S., and really thankful that all of you could join us today. I'm here to help kick off this Health Equity Collaborator Series, which we first kicked off in February, so this is the second in the series. Hey everybody, I am Beth Roden, our head of communications for Bayer in the U.S. And this is part of our commitment to improve lives and communities where we live and where we work and where we play. Our first session focused on advancing heart health, discussed innovative ways to address health equity and access when public, private, and nonprofit organizations come together. Today, in the second of this three-part series, we're going to take a closer look at increasing access to nutritious food. Food plays a critical role in health. It's linked to health heart, and there's an urgent need today to make nutritious food even more accessible to avert a food security crisis. And the numbers really paint a dire picture. The Ukraine crop planting is down by at least a third. People are facing insecurity, and we expect it to rise as much as 240 million by November. And we just recently conducted a poll where we know Americans are worried about food security. 71% are moderately to extremely concerned with food shortages caused by Russia and the invasion of the Ukraine. And the majority in this survey, especially women, see more empty shelves at the grocery store now than in the beginning of 2022. So as a global leader in health and nutrition, we work every day to achieve our vision of health for all and hunger for none. Bayer is uniquely positioned to help advance and really drive equality and equity in these crucial areas. So the first step is engaging with those on the front lines, identifying partnerships to combat hunger and health disparities. So we're really thrilled to host today's session to dig into access, nutritious food, and how we can work together across public and private sectors to promote food security. So I'm really pleased today to be joined by four esteemed panelists, and I'm going to give a brief introduction of those folks today. So we have Dr. Sara Bleich. She's the Director of Nutrition Security and Health Equity in Food and Nutrition Services at the U.S. Department of Agriculture. She's a policy expert and researcher, specializes in diet-related diseases, food insecurity, and racial inequity with more than 175 peer-reviewed publications. Kamal Bell is the CEO of Sankofa Farms, LLC. He's an innovative farmer. He started his 12-acre farm in Durham, North Carolina, so where I used to live, so it's good to see you here, Kamal, to improve food policy, teach nutritional literacy, and educate kids about important agriculture-related professions. Jenny Maloney is a colleague here at Bayer. She works in our global strategic accounts manager for our vegetable seeds business. She works in North and South America to promote our full platform of Bayer fruit and vegetable seeds. She has a focus on consumer demands and trends in food and works with partners across the food chain, including growers, food manufacturers, and grocery retailers. Colleen Lindholz is president of Kroger Health, the healthcare arm of the Kroger company. Kroger Health is one of America's leading retail healthcare organizations with over 2,200 pharmacies, 220 clinics, and 37 states. She oversees all pharmacy, clinical, and nutrition operations and services, including healthcare-related digital solutions and telehealth platforms. She's the lead architect of their food as medicine strategy. She's passionate about Kroger's health vision to help people live healthier lives. So I really want to welcome and thank all of you for joining us today in the conversation. So Sara, let's start with you. Share a little bit about the role that you play at the U.S. Department of Agriculture.
Sure. Good morning, everyone. Thank you, Beth, for your kind words and for having me on this LinkedIn Live Healthy Equity Collaboratory Series. So at the start of the Biden-Harris administration, I took leave from my position at Harvard to serve. That was back in January of 2021. And for the first year, I was asked to lead the COVID efforts and serve as a senior advisor in the Office of the Secretary at the U.S. Department of Agriculture, or USDA. Now, in the second year of the administration, I have a new hat, and I serve as the Director of Nutrition Security and Health Equity at the Food Nutrition Service, which is an agency within USDA. And what this role is responsible for is leading a whole of department approach to one of the Secretary's core priorities, which is tackling food and nutrition security. And so just for context, poor nutrition is the leading cause of illness in the United States and responsible for more than 600,000 deaths per year. And children without consistent access to nutritious foods are at higher risk for diet-related chronic conditions like obesity and diabetes. Now, one of the few things that people realize is that USDA has one of the broadest portfolios in the federal government, and this is with respect to both our mission and our geographic diversity. So at USDA, our portfolio curbs poverty and hunger. It makes credit available for rural development, which is where 1/5 of Americans live. We stabilize domestic farm income, ensure the quality of the food supply, develop markets for agriculture, and conserve and protect natural resources, largely through firefighting. This is actually my second tour of duty at USDA. During the Obama administration, I served as a White House fellow and was a senior advisor then to Undersecretary Kevin Concanon in Food, Nutrition, and Consumer Services, which is a mission area within USDA. So that's a long way of saying that it's great to be back and great to be with all of you this morning. Back to you, Beth.
Thanks, Sara. That's really pretty impressive. Some really interesting statistics there that you shared. So let's talk a little bit about nutrition security. So what does this new concept mean, and how is the USDA working to promote that?
Yeah, thank you. So I'm really excited to talk about the game-changing efforts at USDA with regards to nutrition. So let me start with a definition of what we mean by nutrition security. So the concept of nutrition security aims to better recognize the coexistence of food insecurity and diet-related diseases and disparities. So in other words, nutrition security means consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease, and in some cases, treat disease. And this is particularly true among racial ethnic minority populations, lower income populations, and rural and remote populations, including tribal communities. Now, a question that we constantly get is how nutrition security differs from our long-standing efforts at USDA on food insecurity. And so my message to you all is that nutrition security builds on and complements efforts to address food security among all Americans, but it's distinct in two key ways. The first is that nutrition security recognizes that we are not all maintaining an active, healthy life, and it emphasizes taking an equity lens to our efforts. So put most simply, you can think of nutrition security as having consistent and equitable access to healthy, safe, and affordable food. Now, a core part of our mission at USDA is delivering a suite of more than 15 nutrition assistance programs, which together serve 1 in 4 Americans over the course of a year. Now, in fiscal year 2022, the nutrition assistance programs at USDA totaled $163 billion. And together, these programs aim to provide children and income-eligible individuals with access to safe, nutritious, and equitable food, along with nutrition education and promotion resources to help individuals, families, and communities to promote healthy eating. Now, these programs reach tens of millions of Americans, which include more than 41 Americans through a program called SNAP, which stands for the Supplemental Nutrition Assistance Program. It formerly was called Food Stamps. We reach more than 30 million children each day through our national school lunch and breakfast programs, and nearly half of all infants in the United States through a program called WIC, which is Women, Infants, and Children. And this is at about 99,000 schools and 250,000 retailers. Now, in addition to the programs, we also invest more than $1 billion per year on nutrition education and promotion efforts across all of our programs. Also at USDA, we provide a consumer-friendly translation of the dietary guidelines for Americans through MyPlate, and by a broader investment in research and food systems. So that is a long way of saying that we have a lot going on in nutrition security space. If you're interested to learn more, I encourage you to read the report about USDA actions on nutrition security. It came out this past March and provides a comprehensive overview of our activities. We also, on our website, we highlight how we are tackling food nutrition security, including a variety of different activities. And we also have a blog series, which highlights efforts by several of our partners across the country. So please have a look there if you're interested in learning more. Back to you, Beth.
Thanks, Sara. Some great resources and tools to help folks as they navigate and really think about food security. And it was interesting to hear the difference between security, nutrition is security versus food insecurity. So thanks for sharing that context for us today. And it's really encouraging to see what's happening at the USDA. So now I want to turn and welcome Kamal. Thanks for joining us today. I want you to introduce yourself, tell us a little bit more about the work that you're doing at the local level to create a sustainable food source and introduce the next generation to farming and agriculture.
Sure. Thank you for having me. There's a lot that Sankofa Farms does. Sankofa was a vision of mine ever since around 2009 when I started to learn more about giving back to the community in the history of African Americans here in America. So during that time, I was working on my undergraduate degree at North Carolina Agricultural and Technical State University, and I had the urge to change my major from being more laboratory animal science based to animal production or animal industry. So once I did that, I started to get more hands-on experience at North Carolina A&T working at their farm. And upon the arrival of our first son at the latter part of my college career, I decided to get my master's, to stay at North Carolina A&T and get my master's in agricultural education. And once I did that, I began to learn about food deserts and the effect that they had on the Greensboro community and other areas that had similar socioeconomic characteristics to that of Greensboro. And once that occurred, I just took it upon myself and I said, you know what? I want to become a farmer. I didn't know that the farm would morph into what it has now, but I did begin to see that food was an essential component to addressing food deserts. But as I start to work more within the community, you start to look at Black land loss. You also start to see there's an education barrier, a policy barrier. You start to see there's a food production barrier. So we started to build this model here at Sankofa to reflect and address those different parameters that we started to create a food desert. So once we did that, we started to focus more on our agricultural production. We actually went through the Farm Service Agency through the USDA to acquire our farm. So we wanted to tackle the Black land loss that way. And then we looked at the sustainable farming models that started to have an emphasis on sustainable agricultural practices. And once we looked at those things, I started to think about the youth being an essential component of that. So we started an agricultural program with youth here in Durham, North Carolina, that brings them out to the farm and it teaches them not only about agricultural production, but also about life skills. It introduces them to STEM, introduces them to job creation, introduces them to a concept of who they are, and we saw agriculture as being a fundamental component of that process for them. So now we've expanded our farm to 8 tunnels now, which I'm in one. It's a 30 by 72 foot tunnel that we got through the EQIP program through the USDA, and then we have 7 other 14 by 100 caterpillar tunnels. They're smaller makeshift greenhouses, which you can move around and get really creative with. So now through that, we've expanded our farm. We also have bees, where we've worked with Bayer Crop Science, Dick Rogers, who's the head entomologist in North America, to help get our beekeeping program going. And we've also introduced our students to beekeeping, and they're certified beekeepers as well. And then my 5-year-old son has decided to, well, he was 4 at the time, decided to pick up beekeeping too. So we've been doing a lot in the education space as well as the food production space. So our major aim is to create a production model. So anywhere that has similar characteristics to the Durham area and to the Greensboro areas that we identify, we want to be able to take this model of Sankofa, build farms there, and help address food insecurity in innovative ways.
Super interesting. I know I was working a little bit in the bee care program and got to know you a little bit there, but looking forward to next time I visit Durham to come check it out and see your work firsthand for sure.
Oh, you're welcome anytime. Anybody who else is in the area as well, you can just contact me. You're welcome to come and learn about more of what we're doing here at Sankofa as well.
That's excellent. So you just heard, this is a question really for both you and Sara. So you just heard more about USDA's policies, their initiatives to help national security or nutrition security, at the national level. So what do you think is most important to consider from an on-the-ground perspective? And then Sara, I'm going to turn it over to you afterwards to say, what are ways that different organizations like Skincoffee Farms can engage with the USDA? So Kamal, over to you first.
I think that's a great question. I think the best thing that we can do is forge relationships. And I know that we hear that a lot, but the way I want to address it is from moving past the theoretical aspect of it as just realizing relationships that are important to the practical aspect of it so that we can build working relationships with larger corporations and larger partners, because there's only our capacity here, like we're at capacity. We're doing everything that we can. And the part of it as being a growing business, you have to bring in more people, but there are things that can happen, I think, on the local level through funding opportunities that can allow us to address these things, these weaknesses, or just these growing pains. I don't want to use weaknesses, just these growing pains in a more sustainable way so that we can expand our capacity. But I think the only way that we can do that is through relationships with larger organizations where we can take that perspective of what is going on a more national level, but then we can add our local perspective, and then that can create potentially a model that we can use to address this issue of food insecurity.
Thanks, Kamal. And Sara, over to you. What are the different ways that organizations like Skincoffee Farms can engage with USDA?
Well, first off, next time I come to North Carolina, I want to come visit your farm. My grandpa was a corn farmer, and I would just love to come and see it. And what I would say in terms of engagement, so it's great to hear that Kamal and his farm, Sankofa Farms, is already well connected with USDA. We are constantly announcing new opportunities. So recently, in early June, the Secretary announced the Food System Transformation Framework. And that does a number of things, including increasing options for American farmers to process locally, to sell locally, and to adopt practices that are both good for their businesses, but also for climate. So I definitely encourage any farm to make sure that you are signed up for news alerts, you understand the new initiatives that are coming out, talk to the folks that are issuing the grants, understand what options are available to you. But to Kamal's point about, so it's key, particularly from the USDA perspective, to not be scared to reach out and really try to connect with the resources that are available to you coming out of USDA. The second is I would encourage any organization to reach out to me, whether you're interested in learning more about USDA or you're interested in existing or enhancing a partnership. USDA is very committed to nutrition security, but we cannot solve the problems of diet-related diseases and disparities on our own. So we are looking for ways to amplify this work through partnerships with farmers and retail food outlets and food service operators, among many others across the food supply chain. And then the third thing I would say is now is a really important time in our nation's history around nutrition. So we being the royal we, are currently working on hosting the second historic White House Conference on Hunger, Nutrition, and Health. And across the country, there have been listening sessions, and we've received input from additional listening sessions that have been hosted by stakeholder groups. So I really encourage anyone to engage in this work, to share their ideas on the White House Conference website. That meeting will be held sometime in September, and the date will hopefully be released soon. And then the final thing I would say is just the importance of identifying ways to offer culturally and contextually appropriate foods to communities. So basically giving folks the foods that they want to eat. And there are a lot of ways that we are prioritizing equity within USDA, particularly with a focus on how do we help target dollars toward underserved communities. So again, I'll just make a plug for, if you're interested in USDA resources, reach out and really try to understand everything that's available to you. Back to you, Beth.
Thanks. That's excellent. A lot of great resources again. And it was a great segue because I want to turn to our other two panelists joining us today and talk a little bit about that White House conference that's on the horizon. Bear is proud to be a participant and engage in that conversation. We recently hosted some listening sessions that included nutritionists, growers, representatives from the private sector. And so we're going to talk a little bit more about that, both from Jenny and hearing from Colleen. So Jenny, I'm going to go ahead and start with you. Can you describe your role at Bear, and then what you learned through these recent listening sessions that you were able to participate in on this topic?
Sure, great to be here. So as Beth mentioned at the beginning, my name is Jenny Maloney, and I'm in the Bear Vegetable Seed Division. I work throughout the food chain. So today's a great representation of that chain where we work with growers, but we also work with grocery retailers like Kroger. And then we really look at consumer trends and many other factors that are impacting how food is grown and what consumers want. Because many of the things that we have to consider are not only a great tasting broccoli that someone in second grade will actually put on their plate at lunch, but also how it works in the field agronomically, because what works in North Carolina doesn't always work in California, doesn't work in Florida. So we really think about it from an agronomic perspective, but also, how do we really deliver an amazing experience to consumers so that they do choose broccoli or cauliflower. With the White House conference, we've been very active, both in the listening sessions that Sara mentioned, but we also hosted our own convening session to really get that full spectrum from the food chain. So we had farmer growers on our convening session, dietitians. We had over 50 stakeholders with academia, researchers, NGOs, and other businesses. And we did a 90-minute virtual session that was much in line with the White House policy of food, nutrition, ag stakeholder convening. We got really great, unique, diverse perspectives that I think will be really beneficial, and we'll send those comments in to the White House. I think we sent them in last week. So we really looked at how do we eliminate disparities and support the diverse range of individuals and communities that are impacted by hunger and diet-related diseases. And then we also took a look at how they relate to the farmer grower as well, and really looking at the entire food value chain. One of the other things that's important for us to consider, as I mentioned, is what do consumers want? So we can grow the food and educate consumers about its nutritional importance, but we also have to consider what people want to eat and how they incorporate those nutritious foods into their daily life. And Kroger is on the forefront and the front lines of consumer insights. So Colleen, maybe I'll turn it over to you. Can you tell us about how Kroger is engaging in nutrition and your food as medicine strategy?
Yeah, thank you, Jenny, and good morning, everyone. Thank you, Beth, and the whole Bear team for inviting me to be here today. I'm super excited just to talk about what's going on in our country and how we really are bringing nutrition security, I believe, right to the forefront. So Colleen Lindholz, I've been around the Kroger company for 27 years. I'm a pharmacist by training. I just want everyone to know the importance of what I've seen over the years, being at the pharmacy counter with multiple people, obviously getting diagnosed with diseases like diabetes. And they would ask me, but what about out here, Colleen? And they would point to the grocery store. So one of the opportunities we've had inside of Kroger is to try to connect the healthcare side to the food side and really own the prevention space. And as the country's largest traditional grocery retailer, we do believe it's our responsibility to do that and to bring healthier for you, better for you foods to all of our customers throughout the country that, and most importantly, affordable for all. So we put our food and basically our food as medicine strategy together about 5 years ago to try to, again, connect the healthcare side to the food side. And we've defined food as medicine as a dedicated, educated, and personalized approach to eating healthy food so we can live a healthy life and prevent disease before it starts. The very end of the definition of food as medicine for us is very, very, very important. Actually preventing disease before it starts, actually reversing disease. We've done some pilots with our own associates. The Kroger company has 500,000 people that work for us. So we're lucky to have sort of a laboratory of people that we've tried things on. And we've actually reversed disease. People that have had metabolic syndrome going into type 2 diabetes, actually putting them on a specific diet, exercise, opting up to healthier for you foods. We've been able to reverse that, which is obviously an amazing thing to do. Our food as medicine strategy has 5 main pillars in it. The first pillar is product innovation. So, in order to have a food as medicine strategy and really drive customers to understand foods and how they are healthier on the shelf, we had to have a nutrition scoring system. So product innovation is a lot about the shelf on the shelf tag on the actual shelf all the way to our opt-up scoring system, which really takes all the items that we sell inside the Kroger store and gives the food a score. This opt-up scoring system makes it really easy for customers in a commodity like yogurt or cereal to really understand the nutritional value of all the different foods. So the opt-up scoring system is a foundational piece of our food as medicine strategy. Another pillar is research. We feel very obviously driven around bringing trust and research into every single thing that we do. We did a study called SuperWin. It was released a couple of months ago. The results were with the University of Cincinnati and Dr. Dylan Steen. It was about really our dietitians interacting with people in the aisles as they shop and then online. What I love about this is we put ourselves out there as the Kroger company, but we had such conviction that what we were doing was truly moving the mark on health outcomes, that we went after this research study. The outcomes were better, according to the Cardiology Association, better than any other research study they had seen around nutrition. Actually, the second best, research study around nutrition that they had ever seen. So we're on to something here. That had to do with people with heart disease and stroke, the ones that we followed. But research is a really big piece of what we're doing, and we will continue to do more. We research with Tufts up in Boston, and the Milken Institute out in California. We're involved with them too. The three other pillars: customer engagement, partner engagement. I tell you, we can't do this alone. And Sara, I think you said it a couple of minutes ago about how the USDA can't do what they want to do alone. So we're really looking for our partners to be fearless and bold, by the way, in going after this, because it's all about what sits on our shelves at Kroger. So it's not just about our brands and our items that we make, which we are making them healthier for people, but it's about our partners putting healthier for you things on the shelf, where when the customer actually is buying something and they don't even know it and it's better for them, like that's where the magic is. So we're going after our partnerships, our partners, looking at our opt-up scoring system and seeing where their products score and trying to bring a better for you products to the market. So I'm super excited about what we're doing. We're honored that we have a CEO that says he wants to change the way America eats. Rodney didn't say, I want to change the way the people at Kroger eat. The man said, I want to change the way America eats, really helping people understand the role of food as medicine so we can prevent disease. So that's really awesome, I think, because the items that will come out from Kellogg's and Mondelez and all of the big brands won't just sit on the Kroger company shelves. They'll sit on the shelves at every other grocer in the country.
Super exciting. Some really great work. I love that food is medicine strategy. So really exciting. Thanks for sharing that today. And thanks, Jenny, for sharing your perspective as well. So I have a follow-up question for each of you as we think about educating about nutrition. You know, considering the needs of people, you both meant that. How do we really get into the minds of folks to get them to want to eat that food, or Colleen, as you said, to, be purchasing and it's healthier and they weren't even sure of it. So Colleen, from the grocery retailer perspective, what consumer trends are most important to consider, and how are you approaching that?
Yeah, great question, Beth. So the Kroger company has a data analytics wing called 8451, and that we've been following customers because of our loyalty card now for 26 years. I think we're coming up on 26 years of following consumer behavior. So especially coming out of this pandemic and during it, obviously customers wanted to understand immunity and how can I eat healthier? How can I keep my family healthy, during this time? So I think it's 70-something%. I think exact is 72% of our customers are saying, yes, I want to understand what I can buy that's healthier for me. But the question always is this item healthy? And is it healthy for me? And all of us know, by the way, that we're facing different challenges in our life, whether it be someone that just got diagnosed with cancer, someone that just recently is a diabetic, or someone that maybe just having their first baby. Like, everyone wants to understand that. So I think it's, Beth, we're going after very personalized nutrition. So it's not only is this healthy, but the question is this healthy for me? And so those are some of the questions that the Kroger company is we are answering for our customers, because they are opting into some of our programs that allow us from either a direct to their home product perspective, or connect them with the right provider at the right time, like our dietitians that we have licensed in all 50 states. It's really a combination of, going after that. But consumers are most definitely wanting to know what is healthy and what is healthier for me.
That's great. That's super exciting to hear. That's a lot of data, a lot of rich data and insights to help guide that path forward. So Jenny, let's turn to you and hear from your perspective about the role of innovation in food and nutrition, and how are you approaching it in your role at Bayer and in our vegetable seeds business?
Sure. From our innovation in our vegetable seed portfolio, like I mentioned before, we have to balance certain things where what will work actually at the grower's operation in field, and then how that translates when it gets to a grocery store like Kroger and a consumer picks it up and has an amazing experience. So when we think about it from a consumer insights perspective, we certainly looked at insights from Kroger, who interact with customers, hundreds of thousands of customers on a regular basis. So we get insight to say consumers are really looking for more snackability in fruits and vegetables. And then from a vegetable perspective, how do we help create varieties that meet that snackability? Or we'll conduct our own consumer preference panels where we'll go and taste with different consumers throughout the United States and frankly throughout the world to see what makes a cherry tomato or a snacking tomato really exciting to them and tastes great, and how do we get them to reach for a tomato versus other things in the store. So we try and balance what we need to be able to have to make that variety grow in a greenhouse or in an open field environment, but also really to have this amazing consumer experience. And so we've done things where we have new high-rise broccoli varieties where you can actually eat the stem of the broccoli, which you can now, but these are sweeter and more tender. And so not only are we getting consumers to eat a different part of the broccoli that they maybe traditionally don't, but it's a great experience. And then we're using something that may have a food waste component to it. So it's got a sustainability component, a great consumer experience, and it's helpful to the grower too, because they're able to have a more marketable product. So we've got a whole variety of different vegetables that we're consistently and continuing to iterate to really get that great consumer experience.
That's great, and that's great to hear. I just heard about and learned more about that broccoli the other day with the longer stem and turning them into broccoli nuggets for kids in school. So what a great way to really look at innovation and helping serve up a need there. So thanks to all of you. Really fascinating to hear all these different aspects of how we're increasing access to healthy food, and really grateful for all of you for sharing your perspective today. So I'm going to ask our LinkedIn folks that are joining us live today to go ahead and submit your questions for any one of our panelists, and they're happy to entertain those. And while you're thinking those questions and getting them into the system, I have a few. I'm going to kind of go around and give one to each of you. So first, I'm going to start with Sara. So what do you think is the most important thing to consider when we're addressing access to nutritious food? If you could just pick one.
If I could pick one, I would say that it's really important to understand the importance of folks' lived experience and to understand what the actual challenges are that they're facing, which make access to healthy food a challenge. So our work at USDA is driven by lived experiences of our staff, of our stakeholders. We are constantly engaging participants in our program. And I do like to always flag that this includes me. So I'm from inner city Baltimore. My parents, my siblings, and I greatly appreciated the support of a number of USDA's nutrition assistance programs when I was young. And so I think, if you want to make programs strong, you can't just do it from on high. You have to really understand what's working well, what's not working well, and how can we course correct to help these programs be as effective and as efficient as possible.
Great. Thanks, Sara. So Kamal, over to you. So from a farmer and a community perspective, what's most important to you? What's the one thing we should think about?
I think being persistent and realizing that it's going to take a lot of time to address a lot of the inequities in the food system. So an example would be just establishing better working relationships, learning the people your food is going to, being able to be innovative and realizing that it's not a one-stop shop. We're not just going to work together one time and then accomplish this overarching task. It's going to take a lot of time and a lot of understanding from both sides and both organizations in a relationship to try to address the issues we're seeing in the food system right now.
Great. Thanks, Kamal, for that perspective. So Colleen, I'm going to turn it over to you. From your perspective, how can we scale up efforts within a community like the work that Kamal is doing with his farm in Durham?
Yeah, that's a great question. And Kamal, I'm hoping that you're partnering with us. If you're not, I'm going to connect you with the Kroger company as soon as we get off of here, because we should be partnering with you. That is absolutely for sure. I think it's all about trial and error. And I mean, we've been doing hometown pickup. We've got food truck pilots in Texas and Louisville. We have opportunities within the food benefit card world. And I'm not sure if many people know what's going on with food benefit cards. Basically, insurance companies like United Healthcare and Anthem are loading dollars onto cards as a benefit to folks. The thing is the benefits need to be for more nutritious items and not just, I would say junk food. But we are getting to where we're going to personalize that food prescriptions and things like that are a huge opportunity. I think people just need education. That's what the Kroger company loves, because we see 9 million people a day come through our stores. We have that opportunity to just educate people. People just need to know what to do with food. So I think helping us at the Kroger company connect with our customers on an ongoing basis and your customers is a huge opportunity.
Great, Colleen. Thanks. Appreciate that. And love seeing the connections happening right here on this panel. It's great to see. So Jenny, let's head over to you. So what are you seeing as opportunities and best practices for working with our customers and our partners?
Yeah, I think that we fit in a specific area of this entire food chain. But when I think about opportunities here, I think about creating those links between different areas of the food chain. And when I say food chain too, I think USDA as well as a overarching organization that can help create those links. So with access, it's not just we turn a hose on and off and access is fixed. I think about it, being a hose where there's several kinks throughout the hose. So depending on where you are, depends on where that pain point is, and how we address it in one area is going to be a lot different than in a different area. So we have to really look at it holistically, see where those issue areas are, and then figure out how we can come in and public and private sector work together to create those links and help with those access issues. From where I sit, I think we do a lot of work with K through 12 schools. We've sponsored salad bars in schools where kids come through the line, and you'd be surprised. There were some pictures that you may have seen where we did some ribbon cuttings for salad bars, where kids will fill their plate with fruits and vegetables. And I've never seen someone get so excited when we did a carrot taste test. So part of that is education with children and how their food is grown, the nutritious aspect of it. I have a first grader, and so it's teaching her, this is how you can prepare spinach or broccoli or cauliflower. So it's several different factors that we can do. But I think linking together private sector, public sector, we can help sort of accelerate the access issues.
That's great to hear. I'm so glad to know that the salad bar program is still alive and going well. I was part of that many, many years ago, but it's a great program and really great to see that still happening.
And Beth, so, I have something to say to
yeah,
Jenny.
sure,
Jenny,
please, Colleen,
our opt-up scoring system, opt-up has gone to middle schools. And so what we aspire to do is to have a scoring system where kids, it's more gamification, right? Mm-hmm. And not only do you teach them, but then they start to have a game around who can eat healthier. That is what we need to do is educate those middle school, high school kids so that the behavior change is happening early in life instead of waiting till it's too late.
Yeah, absolutely. That's cool to hear. Kids love their games, and what a great way to get them engaged and understanding what healthy and nutritious food is from the early days. That is for sure. So we have a few questions coming in from our LinkedIn Live audience, which is great to see. So Kamal, I'm going to ask you to talk about this first one. It was for you. It's a comment here saying, for someone who's passionate about food security and nutrition security for his community that may not have the best selection readily available, any advice on how to start educating his or her community and securing that healthy food for the future? So maybe it's some insight on how you got started.
I think that's a great question. And I saw it as it came in. I think that one way can be to use the power of the algorithm on the social media platforms. So we know the more, if you work with youth, the more you click on specific content, the more it shows up in your feed. So the immediate thing that came to mind was being able to direct the youth to a page like a Sankofa Farms, and to find farms who are working with youth, so the student can see that, all right, there's somebody young with me. Then there are other relationships the student can make to engage more in that content so they see it more. I think a lot of, and I think I see it on Instagram, just specifically because that's the platform I'm on the most, and I think kids are on that one a lot as well, is that you have to feed your mind the habits and the things that you want to address in your life. Because if you're not, you just spend on idle time, you're going to get all this other stuff. But if you can get the kids to begin to see that, hey, there are farms out here working with you. Fresh food is something that once you learn how to grow, you could potentially partner with some in your community to grow it in their space or your space. I think that opens up the kids' mind. That opens up a whole nother world that they're able to be a part of and that they see themselves being a part of.
That's great. Thanks, Kamal. And I keep saying Sankofi and it's Sankofa. I need to get that straight in my head here. So
It's
my
fine.
apologies.
It's fine.
So, Sara, I think you had something you wanted to tag in and add some perspective to this question.
Yeah, so it's a great question, and I would say three things. One is that there are a lot of nutrition education resources that are freely available on the USDA website. So one is My Plate, My Way. So My Plate is the consumer translation of the dietary guidelines, and there's all sorts of different recipes that are available through My Plate, My Way. The second is that SNAP Education has tons of information about cooking and healthy eating and different things that you can do to help promote a healthy diet. And the third is that for individuals who are enrolled in SNAP, that's the Supplemental Nutrition Assistance Program. Again, it's about 31 million Americans. And now the vast majority, about 97% of participants can use their benefits online. And this was a big game changer with the pandemic. And so what that means is for individuals who participate in the program and who are living in areas where physical access to healthy food is a challenge, you can go online to participating retailers and you can go ahead and make those purchases. So that's something, if either you're on SNAP, if you know individuals who are, this is something to really spread the word about, because to circle back to Colleen's point, a big piece of this is going that last mile and making sure that folks are just aware of what the opportunities are, because there's just so much information out there, and we really need to connect the dots and make sure that interested folks are aware of what is available to them for their use.
It's great, Sara. Thanks for adding that. Colleen, anything you would want to add to that question?
Don't
Good.
think so.
Okay.
I was looking at my next question.
Yeah, all right. I was like,
Just
you're
right now.
jumping ahead. So
That's
we've got another question in here, and we're going to take it over to you, Colleen. So when your program when you're personalizing it, what is healthy? Does it take into account the cultural foods? So maybe you can talk about that a little bit.
Yeah, that's a really good question. And the answer is, as part of our telenutrition program, which again is our dietitians that are able to, connect directly with our customers. Right now it's nationwide via telenutrition, not in all of our stores. We did have nutrition techs in our stores before the pandemic. We had to pull that back during the pandemic, but now we're getting ready to roll out that again. But the key to the dietitians is they do take that personalized approach to dietary restrictions, culture, background, because eating is so personal and it's so emotional and it's so connected to our past. And I remember what my grandma cooked when I was growing up, and we can't take that away from people. So our nutrition program with our dietitians, yes. Does it do that inside of Opt Up right now? Not yet. Now it does suggest better for you items in which, the commodities in which that you shop, but we are still obviously continuing to iterate with Opt Up. And as customers start to give us their own profile and what's important to them, then we will go back with those types of considerations when they're using Opt Up to shop either in our stores or online.
Great, thanks for that. So we have a question in. We all want to help people eat more healthfully, but how do we make improving food and nutrition security a strong business model for growers and consumer-facing the business? Are there carrots and sticks, so to speak? So maybe Colleen and Jenny, you guys want to take that one?
So from a business standpoint,
yes,
obviously eating healthy is been perceived it cost more, and that just depends on how you look at it. Our country has made unhealthy very easy and healthy hard. And when I say unhealthy easy, I mean the example to me would be the 10-cent biggie fry that you can get for just 10 more cents, 3 times the amount that you need, which is not right. So I think this is a combination of understanding that like frozen blueberries are just as nutritious as fresh blueberries, and if you're on a diet, you can definitely stretch those frozen blueberries. From a business perspective, I think as we work with United Healthcare and Anthem to prove out food as medicine and to show that in the prevention space and keeping people on a better diet or whatever lowers overall total cost of care and saves money in the long run, increasing the quality of life for the patient. That's where the business model comes into play, at least for the Kroger company, because in the country is moving from a fee-for-service or product-based system in healthcare to value-based care. And value-based care is all about holistically taking care of the patient. And if we can take care of people better by holistically following them, then we can help get sort of a piece of that pie that's shared when you take care of people better. So that's kind of the way that we're taking the angle of that business case.
Great, thank you, appreciate that. Sara, you want to give some perspective on that, and then Jenny, over to you.
Yeah, so just two thoughts. The first is, I think as we think about the business case, one of the things that's going to be really important, given what we saw happen with the supply chain and COVID and how fragile it was, is how critical it is to invest locally and create local systems which can sustain themselves so that you don't have the issue of suppliers not being able to get from really far away to somewhere that's thousands and thousands of miles. So that's one. The second is to follow the evidence. There is emerging evidence about the impact, for example, of food as medicine to actually helping with patient outcomes. So for example, if you're looking at diabetes patients, there's evidence that food as medicine programs can affect a patient's blood sugar level or their A1C. And so I think robust evidence, which makes a case for why it is important to make investments in food as a way of promoting health, which will then benefit the bottom line. It's just important to thread that needle in a way that the audience that you're speaking to can understand and it resonates with them.
That's great.
And from a vegetable seed perspective, and even a fruits and vegetable perspective, we can think about it differently as we develop new varieties to, enable varieties to grow in regions of the United States where they traditionally are not grown. I grew up in the Central Valley of California, which is one of the largest ag counties in the United States. And a lot of fruits and vegetables grow there. It's got a great climate for growing those types of foods. So if we think about where food deserts are, how can we develop varieties that might grow in areas or greenhouses, hoop houses, low tech, high tech, where they haven't been grown before? Or, can we start to grow watermelon in more hoop house, greenhouse environments so that we can shift growing certain crops closer to those areas where there may be a lack of fresh supply where it has to move. But those are all challenges then that we have to develop the right varieties that will work with growers like Kamal. And again, what works in Fresno, California is a lot different than what works in Durham, North Carolina. So we have to take that into consideration. And then I think really the carrots and the sticks, one of the things that I'll go back to is I can put spinach or carrots in front of my 2, 4, and 6-year-old daughters every day. But if they don't like the flavor of it, they're going to go eat something different. And they're the toughest critics, right? Because they'll tell you or they'll just push it away. So I think this both delivering really nutritious fruits and vegetables, but also really great tasting fruits and vegetables, that leads consumers to grabbing that more frequently. And then the snackability portion, I think that's what makes it more sustainable.
Great, really some good insight there. Really appreciate that. So I'm not sure if we've lost Kamal. I think you're still with us, but just in audio right now.
I'm here.
Okay, you can hear us.
Excellent.
Excellent.
So I switched over.
That's okay. Technology, right? Friend and foe all at the same time. So I just, really appreciate everyone's questions coming in here, and I'm going to turn back to each of you, and I've got a final question for each of you as we wrap this up today. So what are some ways that individuals and organizations can really help advance access to nutritious foods? So Kamal, we're going to start with you, and then Colleen, over to you, then Jenny, and then Sara.
I think one thing we can do is look at being innovative in how we market food to selected populations. So one thing that we did this year was create a CSA, and it's community supported agriculture. Well, I know traditionally over time, like over the last, I'd say 7-8 years, the farmers market idea has been very prevalent and looked at as a solution. But I've found that a CSA model has worked better for getting people access to healthy, nutritious food. And our focus with it is marketing the boxes to the populations, and then also having a culturally relevant items in the boxes. And then we've also found that a question that comes up very often is, what do we do to how do we prepare the food? So one thing that we're going to be doing this year is doing a video series on things that we're growing at the farm and how we're going to be partnering with a dietitian. And I believe he has cooking, some kind of cooking, extensive cooking background as well. And he's done programming before, and we're going to create video segments on how to prepare these items at home. So we want to shift it from just getting people access to food to actually show them how to prepare food, and then what skills are actually necessary to prepare beneficial food. So we're going to be looking at being innovative in approaches such as that to get people more aware and more of to center them in their experience in preparing healthy food for themselves.
That's great. Thank you. Colleen, over to you.
Yeah, from an organization standpoint, I say just partner with us. I mean, we're super excited about our scoring system. We're super excited about bringing innovative products to the market. We're willing to test anything. Just about. Bayer has been a great partner with us in this journey and testing, and we're going to see some of the results that come out of it. Supporting the Senate bill, I think it's 1532. I'm trying to remember the bill right now that's hit on medical nutrition counseling and expanding access to dietitians to more than just a very small subset of the population, which is people with kidney disease and diabetes and the Medicare population. More people need access to the people that can really personalize that journey for them, which I believe are the dietitians. And then Kroger is leading a huge wave of wellness across this country. Our wellness experience, our wellness festival will happen in September. It's a really, while it's a big event in Cincinnati, we aspire to move that wave across the entire country. So if you want to get involved in something really awesome and energetic and brings communities together like never before, reach out to me and you can be a part of it.
Excellent. Thanks for that, Colleen. Jenny, how about you? What's your thoughts, your final thoughts?
I would say from an organization perspective, let's disrupt the system. Let's think about it differently. You know, you talked about gaming as ways to get younger generations excited about eating healthy and nutritious foods. So the things that are going well, that are working well, continue those. But for the other areas, let's try and think really more creatively and disruptively to get people to change the way they eat. Because if you look at like fruit and vegetable consumption, all forms, it really has been flat among a number of major age groups. Then from an individual perspective, I would say, don't think that you as an individual need to have a group of 100 people to get something done. Just you as an individual can make a huge change in your community. So look for opportunities to connect. When I was growing up, we worked with a Title I elementary school, did community garden at the elementary school, taught the kids how to use the fruits and vegetables that they grew, and really connected them closer to the food they eat. So just look for all of those opportunities, because every little bit helps when we try and address this major issue.
Great. Thank you, Jenny. And over to you, Sara.
So 3 things. I would say the first is it's really important that we all think about how do we advance access to nutritious foods by fostering the next generation of professionals. So one thing that is really important, I think, to emphasize is it takes a village to promote and elevate nutrition security. And so we need all sectors leaning in. We need to build a pipeline of farmers. We need healthcare professionals. We need public health practitioners, registered dietitian nutritionists, and many other professional groups to help promote diversity, inclusion, and equity and accessibility to accelerate progress around ending hunger and reducing diet-related diseases and disparities. The second is that while at USDA, our programs reach tens of millions of people, they are undersubscribed. So our SNAP program, which we've talked about a bit over the past hour, about 1 in 5 who are eligible don't participate. In WIC, it's about 1 in 2 who are not eligible, who are eligible that do not participate. And then so many kids get meals during the school year in the school lunch program, but they don't always get the meals in the summer. So help in communities to get eligible individuals to flow through our programs would be fantastic. And the third, and now I'm repeating myself, is just how important it is to look for ways to partner and amplify efforts. I really have to foot stomp on the fact that improving access to nutritious foods cannot be solved by a single organization. We all have an important role to play. And I know at USDA, we're actively leaning in. It sounds like everyone on this call is really actively leaning in. So just encourage those of you who are listening to step up and to join this effort.
Well, that is great. Thank you. So many great thoughts and comments. Being bold, being disruptive, definitely not one person can do it alone. We as individuals can be contributors. What we can do, the power of what we can do when we connect and work together will really make a difference when we talk about food security and nutritional security. So really, this hour went so fast. So thanks to all of you. Thanks, Kamal, Colleen, Jenny, and Sara for joining us today and being with us. And thanks to all of you that joined us virtually for this. Bear is in, a unique position to really help advance health and nutrition. We're committed to building on these efforts, working together in the communities where we live and work, and just really enjoyed this time and session today. Our next Health Equity Collaborator session will be later this fall. It'll be the third of our series, and then we'll look to combine and publish a run out of these 3 sessions that we've had together and these key takeaways. So with that, really thank everyone again for joining. Encourage you all to continue the dialogue here by sharing thoughts and comments on this LinkedIn Live page, and stay connected. And as we heard from all of our panelists today, go out there and let's get involved and be part of the community and really help shape this next generation. So thanks again and stay well.